Thank you, Colin, and thank you to the City Club. Good afternoon. I'm Deborah Kafoury, your Multnomah County Chair, and I use she, her pronouns. To those of you watching the stream right now, I want to thank you so much for taking the time to join me today, albeit virtually. I feel especially honored to have the chance to connect with you in the midst of the unprecedented circumstances we find ourselves in due to the COVID-19 pandemic. I also feel proud to stand here today to share with you the state of Multnomah County, because the power and presence of our community of Multnomah County remains a grounding force now more than ever. But I'm going to be upfront with you. This 2020 State of the County address is going to depart from those of the past. Instead of being together in an event space, I'm speaking to you from a nearly empty conference room, headquarters, where I moved my office in an effort to respond more quickly to this crisis. And to do what we usually do, focus on telling the story of the county's accomplishments over the last year, and there are so many, would feel out of touch with the state of our world, and more specifically, with our own community. So looking back isn't what we need most right now. Rather, I'd like to use this time to share how Multnomah County is responding to the COVID-19 crisis. Because what we're doing and how we're doing it says a whole lot about who Multnomah County is and always has been. About our values, which are enduring. About our role, which is steady, and about our dedication to serving the community, which has never flagged. And in doing so, we move forward together with confidence as a community, led by the very same values and priorities that will help us get through this crisis. So let me tell you in a single word what I believe the state of the county is at this specific moment in time. Grateful. First, grateful that so many of us can practice social distancing with our families or roommates, that we can remain in touch with our loved ones, and that we've made it through another wet Northwest winter. Grateful to all those who continue to go to work every morning or evening to jobs that now everyone understands are and always have been essential to daily life. Whether that's caregiving, delivering food, mail, or packages, collecting trash, or serving on the front lines in a hospital, a nursing home, or a homeless shelter. So while the president continues to worry about the stock market, I think all of us owe a debt of gratitude to those who literally stock our markets with nourishment and small necessities. Grateful that this community has offered the best of itself to each other during this trying time. And I feel truly grateful that Multnomah County had the prudence to begin preparing for COVID-19 early, before it even had a name. We launched our initial response team on January 28th, just a week after the first case of the virus was recognized in the United States. 1 month later, we fully activated our Emergency Operations Center. County employees have been working around the clock ever since, rising to meet the rapidly emerging needs of this public health emergency. Beyond a shadow of a doubt, this crisis has already changed us, and it will continue to alter the way our world works. But my hope is that it also recalibrates our understanding of who and what matters. The daily effort to do what is right, to serve our community with compassion, to ensure equal and equitable treatment, to protect families, and to look out for our vulnerable neighbors. In essence, the work of Multnomah County. Over the course of just a few short weeks, the depth, breadth, and swiftness of COVID-19's impact on our community has thrown into spotlight has thrown a spotlight onto the many crises that existed in our community before this pandemic. The crisis of homelessness and housing affordability, of food instability and domestic violence, of underemployment and over-incarceration, of disparities in our healthcare and shortcomings in how we support older adults and working families. This pandemic also exposes the pervasive role of racism in America, which causes all of these inequities to be experienced more deeply and more acutely in communities of color. In short order, the arrival of COVID-19 has done more than exacerbate the disparities and inequities that people experience. It's thrown back the curtain so that no one can deny that these crises exist in every community. But just as these challenges are not new, neither is Multnomah County's work to address them. In fact, stepping into these disparities to bridge the gap between how things are and how things should be is at the core of Multnomah County's mission. It's what sets Multnomah County apart from other institutions. Multnomah County shows up for our neighbors living on the edge or on the margins, for our neighbors feeling desperate and at their wits' end, for our neighbors facing impossible decisions. We lean into these problems because we know how critical it is to act. Of this emergency, our public health department has been at the forefront of the county's response. Their role, protecting our community, has never been more critical or more challenging, and they continue to respond with grace every single day. Nurses and epidemiologists from our communicable disease services team have answered hundreds of calls, contacted every county resident who's tested positive for COVID-19, and followed up with more than 350 people who were their closest contacts. They've worked tirelessly to understand the virus and its spread in our community. And just this week, unveiled a regional data dashboard of COVID-19 cases across 4 counties, detailing everything from the common symptoms to the number of hospitalizations. In conjunction with emergency operations and county communications, they quickly set up a centralized public COVID-19 website with vital information, resources, and guidance that takes away some of the fear of something so unknown. Dr. Jennifer Vines, our expert health officer and scientist in residence, has led the Portland metro area response, guiding our policy decisions, partnering with the state and our hospital systems, and informing the public through regular press events. Dr. Vines has been the exact authority our community has needed throughout this unsettling time, and we are so very fortunate to have her at the helm. And throughout the response, public health has kept equity at the forefront, because it's not just a lens that we occasionally look through, it's a way of seeing the world and approaching our work in partnership with those we serve. COVID-19 information has been translated into 24 languages, and we're working on creating audio in 20 additional languages that lend themselves better to an auditory medium. We've been intentional about communicating directly with organizations that focus on serving people of color to make sure that they are receiving the information they need to work with their clients as safely as possible. Public Health has also called on its advisory board to shape some of our most sensitive recommendations, helping us think through issues, like helping us think through how issues like social distancing intersect with diverse cultural values. My highest priority from the beginning has been to slow the spread of this virus. And we know a key strategy is to stay at home. But people who don't have a home can't stay in one. So I'm making sure people can stay in their housing during this pandemic. It is a public health imperative. That's why on March 17th, I ordered a temporary moratorium on residential evictions. Housing is probably the single most important piece of financial and emotional security we can provide, especially as an unprecedented number of people lose their jobs or see their incomes plummet. That's also why we've been laser focused on our neighbors who do not have housing and are particularly vulnerable to the crisis. Because when you don't have a home, you can't stay at home. At the beginning of March, we worked with 14 organizations to contact more than 2,500 people who are staying outside and hand out hygiene products and information. Instead of closing them, we kept our 2 winter shelters open, and in a period of just 2 weeks, we opened 4 temporary shelters to create social distancing between our shelter residents. I can't say how proud I am to see the community collaboration that led us to opening the Oregon Convention Center, the Charles Jordan and East Portland Community Centers, and on Monday, the Mount Scott Community Center. So nearly 1,000 very vulnerable people across our shelter system can socially distance in shelter. Working with public health and the Joint Office of Homeless Services, we began planning for what to do if someone in shelter shows symptoms of the virus but doesn't yet have a test. One morning, David Mogg from the Jupiter Hotel heard me on the radio asking for hotel space where medically vulnerable shelter residents could stay. He called my office, and by 3 o'clock that afternoon, we had an agreement, and by that weekend, people were moving in. We have seen that same generosity in the hundreds of nonprofit workers and volunteers who are keeping our shelters, meal programs, supportive housing and outreach programs going during this critical time. They have met uncertainty with fear. They have met uncertainty and fear with courage and grace. Thank you. County employees have also stepped up. Percy Winters Jr. works in the health department, managing contracts for vital services. He's also the president of our largest employee union, AFSCME Local 88. In response to the COVID-19 crisis, he has been working to set up and staff shelters to help bend the curve and help people who need it. Percy's message to fellow employees is this: if there's anything out there that you can do, you can be a part of this. Help out. They need you, we need you. We all know that staying home under the governor's executive order is challenging. But for domestic violence survivors and people in abusive relationships, staying home may not be safe. In fact, it might be more dangerous than before, and in some cases, lethal. To protect families in danger of abuse, we have moved quickly to make a $100,000 emergency investment into hotel vouchers. The closure of schools across the state, while necessary, threw thousands of families' routines into chaos and laid bare the dearth of affordable childcare options, especially when they're needed in a pinch. In the first days of the school closures, I heard from many county employees whose roles required them to come into work, but they simply could not find affordable or appropriate childcare. So what did Multnomah County do? We stood up subsidized childcare for essential county workers, partnering with several local childcare providers. Among them was OMSI, who had the personnel, the facility, and the flexibility to step up and provide care for the kids of county employees. And from what I hear, the OMSI staff have poured their passion for exploration and curiosity into our county kids. Thank you, OMSI. COVID-19 related school closures also exposed just how many families rely on schools to provide their children with healthy, consistent meals. I want to personally thank our school district partners who have worked since day one to provide breakfast and lunches to thousands of school kids. I also want to give a shout out to our amazing partners in the Sun Community Schools Network. It would be impossible to thank just one person or just one organization. Schools closed. Our Sun nonprofit partners have quadrupled their efforts to provide food boxes to help our families in greatest need. The result is that hundreds of adults across our Sun partnership have worked at 20 different sites in 6 school districts to make sure that 1,500 households a week do not go hungry. That is community resilience. But we also know that food insecurity transcends age. The disruption of daily life caused by COVID-19 puts older adults in our community at risk of going without food and without human connection too. You understand this better than the county's Aging, Disability, and Veteran Services Division, which is leveraging its network of partners to reach out to older adults, even those who aren't already engaged with our services. They're arranging meal deliveries and offering other kinds of support that will send the message to our seniors that we will not leave them behind. It's a connection that county partners do with their whole hearts. Just ask Cynthia. Cynthia is a former landscape designer who lives by herself in Southeast Portland. And she's made a deep connection with Amanda, a staff member from Store to Door, one of the county's partners. Cynthia has groceries, prescriptions, and just the right pet food to feed her birds on the back patio. Without their relationship, Cynthia says she'd be up a creek. Over the last few weeks, they've been saying hi, chatting, and laughing, all from a safe distance. Yesterday was Cynthia's 75th birthday, and while they would have loved to share a hug, a warm smile and a conversation from 6 feet away had to do. Still, Cynthia says that connection is such a wonderful thing to have right now. Well, Cynthia, if you're watching, happy birthday from all of us at Multnomah County. And thank you, Amanda, for being a friend. For people of all ages, the Multnomah County Library System continues to offer a vast world of online and virtual enrichment. Deciding to close all of the libraries on March 13th was one of the toughest choices we've had to make since we started dealing with COVID-19. We all know how much Multnomah County residents from all walks of life love and treasure their local library. But closing them early on was a necessary action to keep our community as safe and healthy as possible. And it served as a clear sign that the county was taking slowing the spread of this virus extremely seriously. The Multnomah County Library has been a huge part of my life since I was a kid growing up in Northeast Portland, and I can't wait for the day the doors of our libraries swing open to welcome our community back in. During this pandemic, it's especially important to remember the justice-involved individuals in our care. They are on the whole less healthy and more vulnerable to complications caused by the virus. Our public safety partners realized early on the possibility for an outbreak in our jails. So we've been identifying ways to keep people safe that are also aligned with the county's ongoing work to reduce over-incarceration. Our top priority was to slow the spread of the virus by safely keeping those who need to be in jail, and granting release to those who could be safely supervised in the community. This work has resulted in a near 30% reduction in the jail population right now. And in an effort to reduce economic barriers, the Department of Community Justice has suspended supervision fees for justice-involved individuals. Multnomah County continues to find ways to meet the needs of thousands of community members who depend on us for quality, compassionate, and low or no-cost healthcare. COVID-19 has forced us to make hard choices about which programs to keep open, which to close, and which to adjust. The county's student health centers are among our most treasured and valuable community assets, ensuring that every Multnomah County student has access to comprehensive primary and mental health care for no out-of-pocket costs. We committed to strategically keeping one health center open at Park Rose High School in an area where the need for health care access is among the greatest. And I'm happy to share that we are still on track for expanding services where they're needed most. Our newest school-based health center is scheduled to open on time this fall at Reynolds High School in East County. We knew we had to find a way to continue serving our patients at our community health centers while also keeping our healthcare staff safe. So our clinical system scaled back its in-person services and worked quickly to pivot toward alternative methods of care like virtual and telemedicine. Our community health center patients know that we are here for them, even when these unsettling times mean we have to connect in slightly different ways. They know that we're making every effort we can to ease their worries and to help them stay healthy. One of our clinics received a poem from a community health center patient. It's titled Numbers on a Screen, and I'm going to read a section of it to you. We are your patients, lifelong and long-lived because of you. We are numbers on a screen to many, but we are more to you. We are your purpose to give your healing energy day in and day out over the years. We thank you. Seriously, it is beyond words. That's how we know we're doing the right thing, not just in our clinics, but across all parts of the county. As long as we keep the people of Multnomah County, as our patient poet wrote, our purpose, we are on the right track. The impact of the coronavirus pandemic can't be understated, but neither can the ways in which Multnomah County has responded. I am deeply proud of and grateful for all of the dedicated and skilled Multnomah County staff members who have approached their work, whether in our buildings or from their homes, ready to respond quickly, protect the people and the populations we serve. And I am especially grateful to my colleagues who make up the Board of Commissioners, each of whom have shown great compassion, vision, and skill to lead our community in the face of this crisis. Commissioner Sharon Myron, Commissioner Sheila Jayapal, Commissioner Jessica Vega-Peterson, and Commissioner Lori Stegman. But here's the thing. Our commissioners and our employees were doing so much of this work even before we knew of COVID-19. We have been working on these systemic issues and inequities that result in daily injustices. And that's why Multnomah County was able to spring into action once COVID-19 hit. It takes a special type of person to do the work of addressing problems that at times feel intractable, but that's what Multnomah County employees do. That's what the commissioners do. They show up day after day to do the work because they know that this work matters. It matters to them, it matters to the people we serve, and it matters to the health, safety, and well-being of every member of this community. I know we will need to figure out how to stretch our budget even farther and how to force the state and federal governments to step up their support for our local communities. But that will happen. And we will do it whatever it takes, however messy it gets, because that is who we are. We know our community, and we will fight to protect our ability to thrive. And after COVID-19, we will continue to be the county government people can rely on. We'll feed those who are hungry. We'll support those who need addiction or mental health treatment. We'll uphold public health. We'll provide shelter to those without a home. We'll help people reintegrate into the community after incarceration. We'll provide accessible health care, marriage licenses, and pet adoptions. We'll be Multnomah County. But until then, aside from staying home and staying healthy, what can you do for your community? We can't all be out there providing health care to people who are ill, stocking grocery shelves, or providing shelter to those who need it now more than ever, but we all can do something. We can tend to our neighbors directly and indirectly. We can fill out our census so that our community is counted correctly and comprehensively. We can practice patience and graciousness, not just to others, but to ourselves. And we can vote in the upcoming May election to finally fund homeless services so we can be the first metro area in the country, to actually do something to solve chronic homelessness. We have that power, and you can make that choice. This can be an inflection point, maybe more accurately, a reflection point for us all to remember what is truly important. Before I close, I want to share one more word in addition to grateful that reflects the state of the county at this critical moment in our collective story. Capable. Multnomah County is capable of weathering this crisis. We are capable of coming together and looking out for each other during extraordinarily difficult times. We are capable of acting both compassionately and pragmatically. We are capable of emerging from this pandemic with an even clearer vision of who we want to be as a community. And together, Multnomah County is more than capable of achieving that vision. Thank you.
Thank you, Chair Kafoury. For those of you just tuning in, this is City Council of Portland coming to you with our virtual State of the County with Multnomah County Chair Deborah Kafoury. I'm Colin Jones, and part of why I'm here is to ask you to support City Club with a donation by texting Support City Club to 44321 so that we can keep bringing you important coverage and programming just like this. I'm also here to help facilitate a Q&A session with the chair. And so we're going to move to some questions that we have received from the public. And so I think to start, I think let's start at the big picture. We received a question from Andy Miller asking sort of how will the county reset its 2021 budget process, calendar, and priorities given these new realities?
Hi, Andy. Thanks for your question. Putting together a budget for the county is difficult and challenging even in the best of times, but the complexity is added so much greater when our financial picture is changing day to day. Just in the past couple of weeks, our budget forecast is that we're going to have millions of dollars of less than we thought we had even just a few weeks ago. So while we are still on track to have our budget voted by the Board of County Commissioners in June, statute sets those guidelines, we are looking to ensure that our priorities remain the same. They always have been, and we're used to doing more with less at Multnomah County. We're also hoping that the state and the federal government will help us get through this crisis with additional financial dollars. And to be specific, May 7th is the date when the chair's executive budget will be released. And that's when the community conversation about the county budget will begin.
Sort of following up on that, the city recently laid off nearly 1,000 Parks and Rec employees. Sort of in light of this crisis and the closure of parks, which is a big shift for the city in terms of where it's allocating resources. Do you anticipate shifts of that scale in how the county allocates resources?
I think it's too early to tell what this is going to mean to the number of counties employed at Multnomah County. My heart goes out to those at the city of Portland and those at Metro. I know Metro has had to lay off 40% of its workforce as well. But things are changing so rapidly day to day. We're just working to ensure that as many people can stay employed at this time as possible. And I also want to be clear that we have redeployed many county employees from their day-to-day jobs into other jobs if telecommuting isn't something that is effective in their position. We have hundreds of county employees who are working at our shelters, who are working here in our emergency operations center, working on the front lines to help our community members. But also our county employees are working to keep our community safe by staying at home. That is a really key piece in flattening this curve and keeping our community healthy for a lot of people is staying at home.
So we have a number of questions related to sort of specific interventions and possible tactics. Folks are looking around the country and seeing other cities or counties try certain things. And so I'll raise a couple of them and sort of see if those are on things that are in the works or things that for some reason don't feel like they fit for Multnomah County. So one question is what the county might do around paid leave. And the questioner pointed to San Francisco, which is contributing up to a week of minimum wage dollars or $623 per employee to help employers cover the cost of paid sick leave. Is that not relevant in Portland or in Multnomah County? Do you expect the county to provide that kind of support to employers that might be providing paid sick leave? What do you imagine that to look like?
Great, and I'm going to repeat this question so that our sign language interpreters can follow along for those who are viewing. The question is about what Multnomah County is going to do for all county residents, not just our own employees, around issues like paid sick leave. And to be honest, we haven't yet considered that. I'm sure that, and I'm hopeful that people who are into today's program will send ideas like that our way, because we know, and as I said in my speech, that the well-being of our community depends on all of us working together. It depends on all of us working to keep each other healthy and safe. So there are, I'm sure, many ideas that haven't come across my desk yet, but I'm hopeful that we will hear more ideas like that from the public.
I will preface this question by saying we have gotten questions about the Wapato jail facility at every interview we have done with an elected official in probably the last, I don't know, literally every interview that I've done, someone has asked about Wapato jail, including to folks like Lynn Peterson, who have no management of Wapato. So unsurprisingly, there's a question for you as well, which is, do you envision using Wapato as a COVID-19 treatment or housing facility?
So the question is, do we envision using Wapato really in any shape or form during this pandemic? And while I'll never say never, I will say that at this point, with all of the open facilities that are located closer to services and closer to volunteers and employees, like all of the city's community centers, the Oregon Convention Center, the libraries that are open right now, or that are open for use, we haven't looked at using Wapato. I think that the hurdles still exist as to why we haven't used it to date, and that is it's the transportation, location, it's expensive to operate. So there are still those hurdles there, but again, if we are hit in New York style by this virus, I'm sure that it will be all hands on deck, and there will be many alternatives that we haven't thought of to date that will have to be utilized.
Absolutely. There's been a lot of conversation locally and nationally about healthcare workers that don't have access to personal protective equipment, and in particular don't have access to masks. Do all county employees and healthcare workers that are working with high-risk populations, do all county employees have access to personal protective equipment and masks?
The question is about PPE. It's interesting, during this pandemic, we're all learning phrases that those of us who haven't been involved in healthcare are getting used to. Personal protective equipment. And the questioner asked whether county employees who work with high-risk populations have access to, especially masks. And the answer is that we have a national shortage of PPE. And there is no jurisdiction in this country, I think, that would say that they have adequate amounts of this really essential and life-saving materials. Right now, we're following public health guidelines. So if the CDC, and in conjunction with our public health experts, tell us that a particular group of employees needs to be wearing a mask or utilizing a mask, then we are doing that. And it's constantly being reevaluated. Guidance shifts as time goes by. I mean, we started with kind of business as usual, and now many of our businesses are closed down. It's similar with the guidance around PPE. I mean, we're watching right now as the federal government is looking at whether they're going to require everyone to wear a mask when they're outside of their home. So in a few days, if we hear more from our public health experts in Multnomah County, but I want to assure the public that we are, and our employees, that we are following public health guidelines.
And so to follow up on that, for the employees that, and particularly healthcare workers, that might be working in close contact with high-risk folks, or folks who are known to have or likely to have COVID, what steps are employees taking other than personal protective equipment, and what supports is the county providing to ensure the safety of its workforce?
Well, the most important thing that I'm sorry, the question is about what guidance is Multnomah County giving to our employees who are coming into close contact with someone who might have COVID. First of all, I would say that we know that because the spread of this disease is so far and wide that we have to assume that we are in contact with people who have the virus when we're not in our homes. So that's why we have the stay-at-home guidelines. But there are a lot of people whose jobs are essential and not able to stay at home. And that's when the social distancing comes into place, really requiring people to maintain a 6-foot distance. And we have opened up all of the new shelter beds to space out our shelter clients so that they're 6 feet apart from each other. That's not just for the health and safety of the folks who are staying in our shelters, but it's also for the health and safety of folks who are working in our shelters. As I talked about during my speech, we know that people who are incarcerated are also living in very close quarters, and that's one of the reasons why we've taken great effort to reduce the population of people who are in jail so that we can space people out who are in jail, keeping them safe and the correctional workers safe as well.
That actually flows perfectly into another question. So we have one questioner who appreciated the information you shared about the reduction in incarceration in the county and asked if you could share a little more about what you're doing in terms of protecting folks who are still incarcerated.
The question is about how we're protecting folks who are still incarcerated. Ironically, the jails are, they're used to having outbreaks of disease, not necessarily to this great of an extent, but they have on-site healthcare workers 24 hours a day, 7 days a week, 365 days a year. And people are tested as they enter the facilities. They are tested for diseases, not COVID yet, because we don't have that number of tests. We're all hoping for the day when those tests are much more widely available. But people are evaluated when they come in if they have fevers, if they have flu-like symptoms, and then they're put into a special dorm in the jail. So we're trying to separate people who are showing signs of illness from people who aren't. But we know there's still a lot more we can do. That's why we're watching this situation very closely. And we, pretty early on in this pandemic, we had our former Tri-County Health Officer, Dr. Paul Lewis, do an evaluation of the jails in conjunction with Dr. Mike Seal, who is the doctor who oversees medical procedures at the jail. So we have a plan in place. We're working it through and trying to do our best as we all are during this time.
Absolutely. You raised the point of testing, and there's been a lot of conversation about insufficient availability of testing. One thing that stands out to this questioner is that 95% of people tested in Oregon have tested negative for COVID-19. And just sort of struck them as surprising when so many people with symptoms are being denied tests. And so do you know why the negative rate is so high? Like who does have access to tests right now that would lead to that?
The question is about testing and whether the right people are receiving testing, considering there are such a high number of people who are testing negative. Well, I feel like I'm really immersed in this public health crisis right now. I'm still not a trained health officer or expert in public health. So I would actually love to have that caller send me an email so I can direct it to Dr. Jennifer Vines or someone else on our health team to answer that. I will say though that at first, when the testing was first here in Oregon, it was confined to the only ones who were doing the testing. And now we have private companies out there. I mean, Providence has a drive-through testing. So as it's expanded, public health doesn't have control over who's getting tested. which I think is a good thing in that it's much more widely available, but I think we're all hoping that it becomes even more available.
Thank you. This question is about homeowners and property taxes. So homeowners are in many cases negotiating mortgage forbearance with their banks. What is the plan for the county to handle potential property taxes that might be delayed as well? Will there be penalties if people can't pay their property taxes? How will the county handle that from a budgetary standpoint? Just sort of two sides. How are you handling it from a penalty standpoint, and how will you handle it from a budget standpoint?
Great. So the question is about property taxes and if the county is going to postpone property taxes in any shape or form, whether we will forego penalties if people can't pay their property taxes on time. And I think first response to this crisis was to ensure that everyone could stay in their home. We don't need any more people who are homeless or who aren't able to stay in a place to call home. As I've said about other issues, things are constantly changing and evolving, and we're continuing to look at ways that we can help the public respond. We know that there are a lot of people who've lost their jobs, even more people whose hours have been cut back. So we are evaluating all fines and fees that are imposed by the county that we have control over. We're also making recommendations to the state and to the federal government about reducing or forgiving fines and fees that the county doesn't have control over. This is again another area that I would say there's no idea out there that's too big or too. We want to hear from you. If this is something that is important to people, and I know this one is, we're definitely looking at it in a context of all of the fines and fees that we potentially impose.
Gotcha. Similarly, on the budget side, how do you expect the county's budget shortfall to affect contractors that the county contracts with?
How do we expect the county's budget shortfalls to affect our contractors? I would say, first and foremost, I sent a letter to all the county contractors last week telling them that we want to work. We're not going to cut off people's contracts right now. We want to work with each organization individually to figure out if there's ways that we can change the scope of that contract to ensure that they don't become out of compliance. We really don't want people to lose their funding because of situations like this that are really out of anyone's control. Looking forward to our next budget, which we're looking at right now for the 2021 budget year, which begins July 1st, we are going to continue to put as one of our priorities and one of our values at Multnomah County is our contracts with local organizations. We have really strong belief based in our values that that nonprofit organizations who are working on the ground with communities that they represent, that they work with on a day-to-day basis, that they have just a real front seat in understanding what their particular community is going through. And now would definitely not be the time to reduce those contracts. We're the safety net together. We're stronger together, and making sure that our nonprofit partners in the community are on solid ground is crucial to our well-being as a community.
Great. We have a question from Diane Rosenbaum. Can you tell voters what they should know to make sure that they can vote in the May 19th primary election?
A question from former Senator Diane Rosenbaum asking about elections. We are really lucky to be living in Oregon where we have vote by mail. And we at this point are not, we're assuming that the election is going to take place the way it does every year because people can vote from the safety and privacy of their own home. I am working closely with Tim Scott, who is our elections director, to ensure that that our that our elections process is safe and secure. You've heard a lot of stories about other states getting their systems hacked or having intervention, and we want to ensure that our voters here feel confident that their votes are being counted and that the voting system is sacred, especially now more than ever.
You mentioned the census. How is the county conducting, or is the county conducting a census for those in county homeless shelters and jails? And what special measures is the county taking to ensure that everyone is counted during this crisis?
A question about the census, making sure that everyone is counted, and especially how are we applying the census to people who are in our jails or in our homeless shelters. First, I want to say that Commissioner Lori Stegman from District 4 is leading our county's census efforts, and she and her team have had to completely retool their plan that they worked for a better part of a year on. So my heart goes out to her and her team, who are still committed to ensuring that every single person in our county is counted. We know that it's essential, as I keep saying, now more than ever, because those federal dollars and the funds rely on making sure that every single person is counted. Doing the census was going to be difficult even before this crisis, because we have a large number of people who are immigrants and refugees. We have people who don't speak English as a first language. And since they moved to an all digital format, there are a lot of people who don't have access. So we had a really strong, solid plan that involved people going out, workers spread out throughout the county. Obviously, those plans have now shifted to do a different strategy, but we have staff who are specifically assigned to count at the jails and at our homeless shelters, because the people who are living in those situations, in those settings right now, have just as much right to be counted as anybody else in our community.
Absolutely. So I have a specific question from a viewer that I'm going to broaden a little bit. So the specific question is, does the county regret telling the community via Twitter to feel free to go out and have a good time on the same day that the governor declared a state of emergency? So that's the specific question, but I would broaden it and say the county leadership is particularly important right now. And so as you look over how the county and the state have handled this crisis, what are the things that you're proud of? And what are the things where you wish things had been done better, or the things that you regret over how we've been handling it?
So the question started off by asking about the infamous tweet, the tweet that shall not be named, that encouraged people to go out. Let's just leave it at that. I will just say that the minute I saw that on Twitter, I sent it out to all of our staff with a few choice words. We had some staff who had pre-plugged tweets in. This is beyond my technological skills, but apparently you can set up tweets to play in future dates, and that was what this one was. I'm sure that the staff person who sent that out is mortified, and rightfully so. I think it really, though, goes to show that things are changing so quickly during this crisis that something that seems one day that was a good idea, or another day seemed like that idea would be, unheard of, could very well the next day be the rule of the land. And that's why I encourage people to be patient and understanding. None of us have been through a crisis like this before. And I would say, we lead, we learn, we respond. There's just, there are many ways in which we have made mistakes, and we will continue to make mistakes, knowing that we are committed to helping the public in the best way that we can. So the second part of the question was, what am I especially proud of in the way that the county is handled? this pandemic and what things do I wish would have been different. Hopefully after this is all over, we can have a group chat with all the with everyone in our community, different perspectives about what was handled well and what could have been better. Sometimes it's hard because we're working so quickly and working around the clock that I'm sure there's always, even in the best days, I believe that there's ways that I could have done things better. I just, what I'm especially proud of is the way that our community has come together. The stories that I hear from community members about how neighbors have reached out, ways people are connecting with friends and relatives that they haven't had a connection with in a while. Those warm my heart and I think keep us all going. Ways in which areas I wish we could have done better. I'll just be completely honest. There was a press conference a few Friday nights ago with the governor and Mayor Wheeler and myself, where we thought we had a clear, concise message going into that press conference. And having a clear and concise message, a unified message, was more important than anything else, because we as leaders need to show the public that we are moving together and that we need to give people a clear message of what to do. That didn't happen. And people were confused. Worked out, and I'm happy about that. But it was a moment. It was a moment that I wish we could do over. The other areas that we have been really just the outpouring of questions and comments from the community has been at least 3 times the normal amount of phone calls and letters and emails that I receive. So it's hard to keep up. We're doing the best that we can, but I want to say to people out there, if you've written me an email or if you've called my office and you haven't gotten a response as quickly as possible, I apologize. We're doing our best. And if you haven't heard back, send us another one. I love the outreach that we're getting from people. Everyone is, they want to know what's going on. They want up-to-date information. And whether it's someone just writing to say, give an idea of a way we could be doing things better, or someone writing to just say, hang in there, thank you. I'd love to hear it all.
Thank you, I appreciate that. We have one last question, and it's focused on the future. So some people predict that certain aspects of our lives will be forever changed as a result of this crisis, potentially a revised approach to remote work, or an increased investment in medical infrastructure, or any number of other potential lasting changes. When you look 1, 2, 5 years down the road, what are the primary ways you believe the COVID-19 pandemic will reshape life in Multnomah County?
The question is about the future and how do I think this pandemic will affect our lives 1 to 5 years in the future? And I mean, I'm term limited in my job. I've got just 3 years left, and I know that the remainder of my term is going to be committed to recovery, helping our community recover. I don't think it's going to be something that's going to happen in a month or 2 or even a year or 2. I think we're going to be focused on this. The financial implications, the emotional implications to our community are going to be that great. But that our community realizes that we're all in this together. And as I talked about in my speech, I think that this crisis really unveiled the crises that are in existence, and those are what we need to focus on. Income inequality, racism, housing and homelessness. Those are the areas that Multnomah County has always been focused on, but now more than ever, we need to focus in those areas. I also think, as you've probably heard in the news, that people are feeling even more stressed and vulnerable right now. The focus on behavioral health, and both from a budgetary perspective, but also as a community, just have been heightened and highlighted. And I don't think that's going to change. I just hope now that we can all be working in that area together.
Absolutely. Unfortunately, that is all the time we have for questions today. Thank you so much, Chair Kafoury, for joining us. And thanks to everyone online who joined us from home and shared your great questions. Thank you again to our sponsors, Wells Fargo and Kaiser Permanente. As I mentioned, civic engagement is as important as ever. If you appreciate this programming and are not yet a member of City Club, I want to invite you to join us. Even online, everyone has a seat at our digital table. If you join now, you get a discounted membership rate of only $96 a year or just $8 a month. Go to pdxcityclub.org and sign up for a membership using the promo code CivicsMatter. You can also support City Club by making a donation today. Whatever you can give, text Support City Club to 44321, and we can all work together to keep democracy moving forward. Thank you so much, and we are wrapped for the day.